The job of our kidneys is to filter the blood to remove waste and toxins. These wastes could be urea from breaking down proteins, creatine from muscle activity, or excess salts and acids. To remove these wastes, it goes through the urine. To test how well the kidneys are able to filter out these toxins, doctors can measure your GFR. GFR, or glomerular filtration rate, tests how well our kidneys are able to filter toxins from our blood through the urine. If the value is 90 or higher, that's good. If the patient's value for GFR is below 90, that indicates a possible kidney disease. This is tested by doing a blood test on the patient to measure their creatine levels. The creatine comes from muscle activity. The kidneys have three mechanisms to maintain GFR. The first one's autoregulation, where the kidneys maintain itself. The second one is through the nervous system's control. And the third one is through hormonal regulation. Part of autoregulation is the myogenic mechanism, where the kidneys test if the blood pressure gets too high, the kidney blood vessels start to constrict to stop the blood flow. On the opposite end, if the blood flow is not enough, the kidney blood vessels start to open up to allow for more blood flow. Special cells in the kidneys detect changes in salt levels and adjust the filtration accordingly, whether it's too high or too low. This is called tubuloglomerular feedback, which is also part of the kidney's autoregulation system. The kidney's second mechanism to maintain the rate of GFR is through neural control, or with our nervous system. This means that in emergencies such as excessive blood loss, our nervous system can override the kidney's autoregulation to prevent excess fluid loss. This means that the nervous system overrides the kidney's ability to filter, so it makes the kidneys filter less so that the fluid is conserved more. Renin-angiotensin-aldosterone system, or RAS, is the third mechanism that controls the GFR of our kidneys. This is done through our hormonal control. When our blood pressure drops or the kidneys detect low sodium levels, this activates the RAS system. Step 1 of RAS is that the kidneys release an enzyme called renin that starts this process. The second step is angiotensin formation. Renin, the enzyme I just said, converts angiotensin-aldosterone, which is produced by the liver, into angiotensin 1. This is then converted by an enzyme called ACE into angiotensin 2. The first effect of angiotensin 2 is its effect on the blood pressure. It raises blood pressure by constricting blood vessels. Angiotensin 2 also stimulates the release of aldosterone. Aldosterone is from the adrenal glands and tells the kidneys to retain sodium and water. By retaining sodium and water, blood pressure and blood volume are both increased. This diagram shows how the kidneys use hormones and enzymes to reabsorb sodium and water. Angiotensin 2 has another effect, which increases our thirst and also increases ADH. ADH is our antidiuretic hormone, which helps us retain water by decreasing our need to urinate. So this third effect means it's telling us to drink more water because we're getting thirsty and to pee less to retain the water that we already have. RAS also maintains our blood pressure. If this system overreacts, our blood pressure gets too high. If it doesn't react enough, our blood pressure is too low. Another key role of kidney function is maintaining pH balance. The kidneys must filter out excess acids or bases. The correct pH of blood is between 7.35 to 7.45. If blood pH is below 7.35, this is considered acidosis. This leads to organ failure. If the pH is too high, this is considered alkalosis. When this happens, there's abnormal nerve and muscle function. The first strategy to maintain pH balance is through bicarbonate reabsorption. Bicarbonate is a buffer that neutralizes pH. The kidneys filter bicarbonate from the blood. Instead of losing it through the urine, the kidneys reabsorb it and put it back into the bloodstream. Because bicarbonate neutralizes acids, by reabsorbing the bicarbonate into the bloodstream, it neutralizes and maintains the pH. The second strategy to maintain pH is that the kidneys actively remove excess hydrogen ions. This is because excess hydrogen leads to acidity. Special kidney cells pump hydrogen into the urine, making it more acidic. This helps raise blood pH when it's too low. The kidneys create ammonium to safely remove the excess acid. The ammonium leaves through the urine, which prevents acid buildup. When there's too much acid, or acidosis, the kidneys activate bicarbonate reabsorption and also pump out more hydrogen. When there's too little acid, or otherwise known as alkalosis, the kidneys pee out the bicarbonate instead of reabsorbing it and then reduce the levels of hydrogen. This diagram shows how the kidneys affect the levels of bicarbonate and hydrogen when the pH is too high or too low.